Jeremy Corbyn.
Thank you very much, Mr. Speaker, and thank you for making the best arrangements possible today to ensure that as many members as possible can ask questions, but also that the government is held to account, which is what the function of Parliament is. Many more people will be mourning the loss of loved ones as a result of coronavirus this week. Our hearts go out to all of them and to those suffering from the disease at the present time. Across our country, people are working day and night to keep us safe, fed and warm. Our wonderful NHS staff, police, firefighters, prison and probation workers, teachers, civil servants, local government staff and social care, all of them are showing the value of public service. They are the unsung heroes, keeping the transport system running, the post delivered, utilities running and our supermarkets properly stocked. I'd like to pay special mention to one group that are usually ignored, forgotten and decried as unskilled workers: cleaners. All around the country and in this building are doing their best to keep our places hygienic and safe. Over the past few weeks, I've asked the Prime Minister many times what action is being taken to ensure testing is being prioritised, and I've received assurances that everything that could was being done. Yet, Mr. Speaker, a leaked email shows it was just 3 days ago that the Prime Minister wrote to UK research institutes to ask for help, saying there was no testing machines available to buy. Why wasn't this done weeks ago, if not months ago, when the government was first warned about the threat of a global pandemic, and what action is now being taken to get testing machines?
Mr. Speaker, perhaps I could begin by pointing out that this is the Right Honourable Gentleman's last Prime Minister's questions, and it would be appropriate, I think, for me to pay tribute to him for his service to party and indeed to the country over the last 4 years in a very difficult job. We may not agree about everything, but no one can doubt his sincerity and his determination to build a better society. And I want to pay particular tribute and thanks to him and all his colleagues for their cooperation in the current emergency as far as possible across party lines. I agree with him very much in what he said about cleaners. They do an extraordinary job, and they deserve all the protection and support that we can give them in this difficult time. And on testing, he is quite right that testing is vital to our success in beating the coronavirus, and as the Health Secretary has explained many times, we are massively increasing our testing campaign, going up from 5,000 to 10,000 to 25,000 a day, and in answer directly to his question, this has been a priority of this government ever since the crisis was obviously upon us, for weeks and weeks.
Jeremy Corbyn.
I thank the Prime Minister for his very kind remarks. I believe in a decent, socially just society. And he was talking as though this was a sort of obituary. Just to let him know, my voice will not be stilled. I'll be around, I'll be campaigning, I'll be arguing, and I'll be demanding justice for the people of this country and indeed the rest of the world. We can only protect the health of us all, Mr. Speaker, if we protect the health of our carers. Yet the charity Sue Ryder, who provide care to people with neurological conditions, have said that their workforce is depleting daily as they have no access to tests. When will all the social care staff have access to regular testing? They are very, very important and obviously very, very vulnerable in this crisis.
He's entirely right. I don't want to repeat what I've just said, except to say that social care staff, in common with NHS staff and indeed other public sector workers, need to be tested as fast as possible. And the answer to his question is we will do it as fast as possible.
Jeremy Corbyn.
Obviously, if they have to self-isolate because they suspect they have the disease and can't get a test, then their work is lost for a week. And obviously those that need the care and support don't get it at that time. There are reports that care homes workers are being turned away from supermarkets in relation to priority shopping, not being allowed to buy more than certain items that they desperately need to feed their residents. What is the Prime Minister's plan for making sure that care workers can get the vital food and supplies they need for the people that they're caring for?
Well, Mr. Speaker, as he can and the House can imagine, we've been in regular contact with all the retailers, all the supermarket chains. I had a conversation with all of them a couple of days ago, and they were absolutely determined to ensure that key workers do get time in supermarkets. If there is a particular problem, I will raise it with them again.
Jeremy Corbyn.
I hope the Prime Minister will, because care workers are on the front line looking after the most vulnerable people within our society, and keeping our care homes safe and well should be and must be an absolute priority. The Prime Minister has been saying for quite a long time that NHS staff will get the equipment they need, yet the Healthcare Supply Association, just get that, has been forced to use Twitter to ask DIY shops to donate protective equipment to NHS staff. This is an appalling situation. When will NHS staff, social care staff and community nurses and all other staff relating to healthcare get the PPE equipment they absolutely, desperately need?
Well, Mr. Speaker, I can tell him, and he's absolutely right to raise this issue. I know this has been a concern, and we had a long meeting on it this morning, but I'm assured that not only are the stocks there now, the Army is now distributing the supplies to all the NHS staff, all the hospitals that need it, and in the last 24 hours, they have distributed 7.5 million pieces of equipment.
Jeremy Corbyn.
It's important they get it, because yesterday 77% of NHS chiefs who responded to a survey said that the lack of staff testing and staff shortages were the two biggest areas of concern for them. Last week, the Prime Minister stood in this chamber at the dispatch box and said that he would, and I quote, protect private renters from eviction. He absolutely said that. Yet, some renters will be getting eviction notices as early as next week. The Prime Minister appears to have gone back on his word. So will he now finally absolutely ban evictions for 6 months in line with the renewal period of the emergency legislation which is going through its parliamentary process at the moment?
He raises a very important point about the need to protect renters, which is why I answered in the way I did last week. We've actually gone further now, as he knows, by lifting up the local housing allowance to the 30th percentile of median rents, which will be very important for many people on low incomes across the country. But we are also, as he knows, making sure that no-fault evictions are no longer legal, and that is part of the bill.
Well, unfortunately, this isn't what the reality is on the ground, as many of my colleagues will point out. We are getting constituents in touch with us who are being threatened with eviction now because they are in rent arrears, because they cannot work because of the shutdown over coronavirus. Can we just be absolutely clear, and will the Prime Minister make sure it's legislated that nobody can be evicted during this first 6-month period of this emergency from the private rented sector? I'm going to continue my questions shortly, Mr. Speaker, in the second part of this session. But I just want to ask this question to the Prime Minister. Many British people abroad feel a bit abandoned by their government, with many fast running out of medicines, with the host countries in lockdown, flights being cancelled, accommodation cancelled, and insurance either about to expire or not covering the much-needed costs until they're able to return home. These British citizens have a right to turn to their own government for help, and hour-long delays on phone calls are not acceptable. They feel abandoned. Can the Prime Minister, as the Foreign Secretary was asked to do yesterday, update the House on what his government is doing to bring people home and provide the emergency costs for the medical needs that many British residents abroad actually have at the present time?
Mr. Speaker, he can take it that we are certainly doing everything we can to bring back British nationals, British citizens from abroad. A huge operation is going on now to repatriate them, as he will have heard both from the Health Secretary and indeed the Foreign Secretary, where we are protecting renters in spite of what he says. We are doing everything we can to protect our fantastic NHS. We are putting, as a society now, we are doing and as a country, we are doing a quite extraordinary thing, which is for the first time in our history, to get through this crisis, we are putting our arms as a country around every single worker, every single employee in this country. It is a quite unprecedented step, and he will be hearing more. And I know there are concerns about the self-employed, but he will be hearing more in the next couple of days from my right honourable friend, the Chancellor. I can tell him that, and I think he said something the other day about this, how this country would come through this experience changed for the better. And there he and I completely agree. And we will get this country through this crisis with these exceptional steps. And I can tell him that we will do absolutely everything that it takes. We will do whatever it takes to get our country through it together. We will beat it together. But the most important advice I can give him as he retires to his I'm delighted to hear he's not retiring, and I think that'll be warmly welcomed by his successor. The most important thing we can all do is stay at home to protect our NHS and to save many thousands of lives.
Second part of Prime Minister's questions, I'm going to open with Jeremy Corbyn.
Thank you, Mr. Speaker, and again thank you for making the arrangements that you have today so that more colleagues can come into the chamber. It is a little odd, however, that we're having to have a double session of Prime Minister's question time to question the Prime Minister when he himself should have volunteered to come here and make a statement at some length on the subject rather than just doing it through press conferences and television addresses. This House is the place where the government should be held to account. Construction sites, Mr. Speaker, are still operating, still working on non-emergency work, despite the new rules. The Chancellor of the Duchy of Lancaster said yesterday that sites will continue to stay open. We heard this morning on the radio a call from a self-employed construction worker who said that he had contracted coronavirus, he was suffering from it, he knew he had got it, but had no other option but to get on the London Tube and go onto a site to work, obviously putting himself at greater risk and putting all other passengers and all other workers on that site at risk. Why was he doing it? Because his site had not been closed down. He had no other source of income to feed his family. So he's going to work, making all of us more at risk as a result. So can the Prime Minister be absolutely clear and give unequivocal guidance now that construction work on non-emergency work should stop now?
Mr. Speaker, everybody should work at home unless they must go to work, and every business that can, unless they have no alternative, they cannot do that work from home. If a business is continuing, a construction company is continuing, then clearly they should do so in accordance with the guidance of Public Health England, and they have a duty of care to their employees. But overwhelmingly what we are saying to the people of this country is that unless you need to leave the house to take exercise, for medical reasons, or to buy essential supplies, you should stay at home, protect the NHS and save lives.
Jeremy Corbyn.
Obviously, people should stay at home and protect others. But if they have no other source of income, then these very difficult, very personal choices are going to be made, and as a result, we're all put at greater risk as a result of it. The self-employed having to choose whether they go to work or stay at home or face losing their entire livelihood, relying instead on an overstretched welfare system which could pay as little as £94 per week. One self-employed person said they need to pay for baby food, rent, council tax and insurance for the car they use for work. Faced with the decision to feed your family and pay your bills or stay at home and not get paid, Why is it taking the Prime Minister so long to guarantee income for all self-employed workers? There are millions of them. Our economy has changed.
Well, Mr. Speaker, we are making absolutely clear to everybody in this country that they should stay at home and save lives. But when it comes to the self-employed and the particular pressures that he raises, I think I've now said several times already in this chamber in answer to other honourable members that we are shortly bringing forward a package, and I think that he would recognise that the steps that the government has taken to provide support for workers, for employees in this country are quite exceptional and unprecedented, and they were warmly welcomed, I may say, by the trades unions themselves.
Jeremy Corbyn.
Speaker, I'm asking questions about the self-employed and those on 0 hours contract and those with no recourse to public funds who have no support. They are in a very difficult situation, and he should understand that there are many of our constituents, for every member of this House, our constituents lead a hand-to-mouth existence. A few days' pay lost is catastrophic for them. And time again, government ministers have told us that workers affected by the crisis could get help via universal credit. Last night, there were queues of over 110,000 people trying to get onto the DWP system in order to register to apply for universal credit. Will the Prime Minister now put extra resources and funding to boost the DWP capacity and relax the often quite draconian requirements on people claiming, so that money gets where it's needed quickly to those people who've got to feed the kids, got to pay the rent, got to survive somehow?
Mr. Speaker, he's perfectly right, and that's why we've increased the funding for universal credit so that it goes up by £1,000 a year. That will benefit 4 million of the most vulnerable households in the country. And overall, we're putting another £7 billion into the welfare system altogether. And as I say, we will be bringing forward a package for the self-employed. But what we are not doing, and this is fully in accordance with the scientific and medical advice, what we are not doing is closing down the whole UK economy. And, you will understand the reasons for that.
Jeremy Corbyn.
We're not asking for the entire UK economy to be closed down. We obviously want people to be safe, but clearly things have to go on. My question was about the DWP resources, which the Prime Minister didn't answer. Well, it wasn't an answer that was satisfactory to me. One of his colleagues is claiming it was a yes. I'll take that. And so that means more staff now for the DWP, quickly, so we don't have 110,000 people waiting. Yeah, I haven't finished yet. Because my question is, Mr. Speaker, while he's about it, and this will give him time to think of the answer, can he... This is not a time for levity. The statutory sick pay level of £94.25 a week, which the Health Secretary admitted he couldn't live on, and despite promising he would ensure workers get the support they need, we've still not seen action on that. So unless we increase statutory sick pay and give protection and access to benefits for those on 0 hours contracts, then the dangers that we're all aware of people going into work or trying to work when they shouldn't is going to continue. We do need very urgent action on this.
Mr. Speaker, he's absolutely right. This is not a time for levity. It's a time for serious action and a serious response to the crisis. And that's what he's seen from this government. And that's why, from day one, we insisted that statutory sick pay should be payable from day one. That's why we've advanced universal credit. And just to repeat the answer I gave a moment ago, Mr. Speaker, we've increased universal credit by £1,000 a year. That will benefit 4 million people of the poorest families in the country. And yes, we do want to see... I pay tribute, by the way, amongst the many fantastic workers in this country, not just in the NHS, not just in social care, but of course in the teaching profession, but in the DWP itself. They're doing an incredible job. They're facing huge new demands. They're doing an outstanding job. And yes, we will support them. And that's why we're putting another £7 billion, as I said just now, Mr. Speaker, into our welfare system.
I don't want to appear totally negative, Mr. Speaker, but it would be better if the whole place had been better staffed in the first place. But I'll take it for what the Prime Minister said, that there's going to be an increase in DWP staff in order that people can access universal credit more quickly. Mr. Speaker, it's quite right that Parliament is virtually closed today, and it's right that the Prime Minister and Cabinet Ministers continue to deliver daily public information sessions, and that is absolutely correct. However, I understand it's going to be possibly some time before the House meets again, and there has to be scrutiny of what governments do. That is what Parliament is for. That is what oppositions exist for. And so I'd be grateful if the Prime Minister could indicate how, over the weeks until Parliament opens again, he's going to put himself open to some form of scrutiny, electronic, whatever it happens to be, so that Parliament can hold government to account because of the levels of stress and concern of all the constituents that we represent.
Well, Mr. Speaker, the Honourable Gentleman is entirely correct. I think the way we've tried to handle this crisis is to be as open and transparent as we possibly can with all our working, all our thinking, and I will work with you, if I may, Mr. Speaker, about how we can make sure that Parliament is also kept informed throughout the recess.
Jeremy Corbyn.
Thank you, Mr. Speaker. All I could say to the Prime Minister on this is, please make sure you make yourself available for scrutiny by this House and by everybody else, because we represent people who are desperately worried about their health, about their economic well-being, and if you're living in a small flat and you're told to isolate and you have a large family and a large number of children, the levels of stress are going to be huge. The levels of stress throughout our society are huge. It's up to all of us to do what we can to reduce those levels of stress and obviously bring this whole situation to a conclusion as quickly as we can. So we need clarity, not confusion. We need delivery, not dither. This crisis shows us, Mr. Speaker, how deeply we depend on each other. We'll only come through this as a society through a huge collective effort. At a time of crisis, no one is an island. No one is self-made. The well-being of the wealthiest corporate chief executive officer depends on the outsourced worker cleaning their office. At times like this, Mr. Speaker, we have to recognise the value of each other and the strength of a society that cares for each other and cares for all.
Minister.
Well, Mr. Speaker, I really want to do nothing else except to associate myself fully with the closing words of the Leader of the Opposition. And I think that what this country is doing now is utterly extraordinary. We are coming together as a nation in a way that I've not seen in my lifetime to help to defeat a disease and to help save the lives of many, many thousands of our fellow citizens. And we all understand that that will involve a sacrifice. But we're gladly making that sacrifice. And the most important point I can perhaps make to the House today is that that sacrifice is inevitable and it is necessary. But the more we follow the advice of the government, the more strictly we obey the measures that we have put in place, then the swifter and more surely this country will come back from the current crisis, the better we will recover. And so I just repeat my message in case the right honourable gentleman would like to hear it one more time. The best thing we can do is stay at home, protect our NHS and save many, many thousands of lives.